Is February 1st, and that marks the start of National Heart Awareness Month. Unfortunately, a recent survey found that many of us may be at risk and not even know it. Local 10 medical specialist Christy Kruger has details in our HealthCast.
Well, we hear so much about how to prevent heart disease, but researchers with the Cleveland Clinic found that many of us still don't really understand the link between high blood pressure, diabetes, and heart disease.
These results were a little bit disappointing because despite our efforts over the years to try and educate people, we're not making as much progress as we would like. And there's still a lack of understanding of a lot of what patients need to do to help make themselves better.
Cardiologist Dr. David Walensky says that people need to really understand that it's not just one thing that affects heart disease.
We did a good job when we were focusing on cholesterol. People knew their number, they could take a medicine, and it got better. But now we're focusing on a lot of other things in which the patient has responsibility. Exercise, eating properly, following up their blood pressure and taking their medicines properly. And there's not as much buy-in from the general population on that.
And another thing you may not know, we all need to start heart screening in our early 20s and cholesterol screening, believe it or not, in our late teen years. Also in today's HealthCast, results of a study out today about the possible link between electronic cigarettes and heart disease. Researchers have found that those e-cig users were more likely than non-smokers to have increased adrenaline levels and stress in the heart. Scientists say it's the nicotine in the product that leads to these adverse effects. Further studies, though, need to evaluate whether removing the nicotine altogether reduces the risk of heart disease. With your HealthCast today, I'm Christy Kruger. Back to you.